A very warm good evening to one and all. Welcome back to today's session. Today we have our guest speaker, Dr. Arohi Pandey, ma'am. So today's topic will be understanding organon of medicine and its important in clinical practice. So thank you, ma'am, for our. We welcome you to the board, ma'am, and we welcome you all the participants. Over to you, ma'am. Thank you.
Okay, thank you so much, ma'am. Good evening, all and one present over there, and thank you, Aisha, for giving me opportunity to share my clinical knowledge about the organon or to the students and all the participants. Thank you. Before we start, what I feel that in the college days, organon is much and much over, much and much underestimated. That organon is just a theory, it's just a philosophy, but organon is the final court of verdict. You, with the help of repertory, you select the medicine materia, you select the medicine, but for dose potency interpretation, if it won't go right, then the medicine won't be able to give the result. So this organon is our final court of verdict. So, History and Purpose by Hahnemann, that this foundational text written to guide us the homeopathic principles to practice homeopathy. And rather, we can say organon is the heart of homeopathy. Without organon, we are not able to practice homeopathy. And organon is the one which makes our homeopathy art and science. And organon of medicine is beautifully written in the form of aphorism and with added footnotes whenever it is required. And aphorisms are the short concise statement that expresses the general truth, but with aphorisms, they individually has individual meaning, and yet they are interrelated to each other. Suppose we think first aphorism is a mission of the physician to cure. In the second aphorism, how the cure should be. In the third aphorism, for cure, what the knowledges the physician should possess. And the fifth aphorism, what are the causes which deviates from the health. And this is the way it goes on in the whole text. A practical portion and this theoretical portion, 1 to 70 and 71 to 291. So if we are just memorizing organon, that this aphorisms we have to memorize, so we are not able to understand the organon properly. So for that we have to remember it methodically, and organon principles from day to day life, not only from exam point of view, but from the practice clinical point of view, that will help or during clinical practice, and it will last, this knowledge will last for the lifetime. What we get from organon, the organon teaches us the fundamental principles of homeopathy, mission of the homeopathic physician, what is the concept of disease related to dynamic vital energy, then the concepts of health, disease, cure, what are the causes of the disease, that is exciting cause, maintaining cause, fundamental causes, that are the miasms, then for totality of the symptoms, that is the portrait of the disease for us, it's a diagnosis for us, case taking, drug proving, then judicious employment of the homeopathic medicine. Other than that, posology, LM potency, remedy reactions, second prescriptions, and importance of diet and regimen other than the medicines. Thus, it prepares the homeopathic physician to learn the fundamentals of homeopathy and to practice healing art. So, it's a gift to humanity as the greatest healing art. Homeopathic is the only system of the medicine which cures. And Dr. Honeyman teaches us in Organon that where we need to go and where we need to stop, scope and limitations of homeopathy. So before in this lecture, we will be revising Organon and how we can apply it clinically. We will see it. Aphorism 1, that is based on the mission of the physician. The mission of the physician is to cure. And that is followed by how to accomplish the mission. Aphorism 2, how a cure should be a gentle and annihilates the disease from in its annihilation of the disease from its whole extent. And the third aphorism, physician know the limits of himself and curability of the disease, how the medicines are prepared. Meanwhile, in aphorism 4, he talks about the prevention of the prevailing diseases. Aphorism 5 is a double C, that is the cause and constitution. Cause of disease, that are the exciting causes, maintaining causes, and fundamental causes. Constitution, look of the patient, mental makeup of the patient, social relation, that is his life space. Rather than we can say aphorism 6 says that physician should be free from the prejudice. Aphorism 7 talks about the most important part of the case taking, that is the totality of the symptoms. So, which is the outwardly reflected picture of the internal essence of the disease. And when it is in a further, it is explained in the aphorism 8. When it is eradicated, na, the person is free from the disease. And symptoms totality, the symptoms, all the symptoms we get from the patient, they are not included in the totality of the symptoms. So symptoms totality and totality of the symptoms, there is a huge gap between them, and in between them there comes the analysis and evaluation, identification of the symptoms, and how much importance we give to the symptoms to bring them in the further totality. Aphorism number 9 to 18 talks about the vital force, which is self-preserving. The only work the vital force does is the self-preserving. Anyway, it preserves the body, unintelligent, and when in the trouble, ask for the help. So the symptoms, which are the symptoms we see, the diseases, they are also the part of the self-preservation of the vital force. So whenever the vital force cannot resist this inimical agents, disease causing agents, it throws us the symptoms and asks for the help. And the cure can be cure is the restoration of the vital force, that can be done with the help of the dynamic medicines. Aphorism 19 to 27 deals with choosing and administering homeopathic remedies whose action is known through the proving them in the healthy human beings. Because our homeopathy is based on the practical application of the nature's law of cure. Because it is not possible to apply the nature's law everywhere and anywhere, and we don't have the regulation of the dose in our hand. So that explained in 19 to 27. 28 to 69, it explained that how the cure takes place by artificially producing the disease. Primary action of the drug on the vital force takes place, and that's why this primary action of the drug is also known as conjoint action, where here vital force equally plays the passive role. And then how the secondary curative action or counter action takes place. The secondary curative action cures the disease. And further in this aphorisms, where to use the other system of medicine in the case of emergency, where the vital force is crying for help, and everything is explained in 28 to 69. And in aphorism 70, here the practical part of the organon of the medicine starts. Whole organon is rather than practical part, we can say whole organon, a practical part of the organon is based on aphorism number 71. First is it has the 3 points necessary for the process of cure. The first one is the how the physician has to ascertain to be known in order to cure the disease. So aphorism number 72 to 104, and that is uh, knowledge of the diseases, classification of the diseases, and case taking. So this by 72 to 104, we have one-sided the picture of the patient. Second, 105 to 145, how the physician has to gain the knowledge of the instruments adapted for the cure, that is pathogenetic power of the medicine, of the artificial morbific agents, that is our medicine. So that knowledge can be gained through the drug proving and clinical symptoms. This and in this he explains that how the knowledge of the how the proving can be done, who is the best prover, and everything is explained in this aphorisms. And the last one, that is the most suitable method of employing the artificial morbific agents, that is 146 to 291. So one side we have the picture of the patient, totality of the symptoms. One side we have the totality of the medicine, but how to make apply them both, that that can cure, and that is the third one, most suitable method of applying artificial morbific agents. So we'll start with aphorism number 72 and 73. Acute 72 and 73 talks about the acute diseases which are having sudden onset, rapid progress, severe symptoms, short duration, ends in recovery or death of the patient. So much intense symptoms are there. So if the patient is not treated on time, it ends in death of the patient. They come sudden without any notice. It has three types: individual, sporadic, and epidemic. Individual diseases that are from varies from person to person. It can happen to anybody. It can attack individual at different place, different time, a different location. The cause of this individual disease, acute disease, whenever the acute disease comes, there must be an exciting cause. In the individual disease, the major role is played by susceptibility, individual susceptibility and exciting cause. Then comes the sporadic disease. So this is the diseases which happens a group of people here and there. And the causes of the sporadic diseases are identical susceptibility, that Dr. Hahnemann has used the word identical susceptibility, and telluric and meteoric causes. And then comes the epidemic disease. In the epidemic disease, the which prevail among the thickly corrugated masses, and it affects the lots of people. The causes for epidemic diseases are inundations of war, flood, drought, etc., etc. And this another is the peculiar acute miasms. These two are the causes. And epidemic disease again has the two types, that is endemic and pandemic. Endemic, the epidemic disease which yearly comes in the particular area, and in pandemic, that is this which affect all over the world, and that we have seen in the times of the COVID. Uh, I will be sharing the case of individual acute disease. A male patient aged 30 years presented with a complaint of dyspnea, especially on exertion since 4 days, which is aggravated in the damp wet weather and while lying down. Complaints return annually, especially in June and July. Yes, acidity, aggravation from pickles, fear of incurable disease, anxiety about the health. He gets easily angered. He is tired of life, although he is intelligent. On examination, the expiration is longer than the inspiration, and bilateral wheezing is audible on the auscultation. First prescription, arsenic 200 BD for 3 days. And in the follow-up, patient is much better, no dyspnea, but wheezing was present. And then again, further repetition of the medicine. So within 8 to 9 days, there was no wheezing. Because in the individual disease, when we prescribe on the basis of the acute totality, we are going to get the results. Another case, a patient came along with fever and joint pain since 3 days, which has aggravation from movement, damp, wet weather, and better by rest, which is accompanied by the severe weakness. Diagnosis was chikungunya. Prescription, Bryonia 1M was given BDS for 3 days, and within 3 days, his symptoms were much better. And after in the another prescription, the patient was better with the bryonia, but still weakness in the all the symptoms subsided, but weakness and joint pain are still present. And at that time, China 200 BDS was given. So I on 10/7 there was no weakness or pain, so that was SL was given for the mental satisfaction. In this case, we can say this is the condition of the patient was status quo after the first prescription, and the second prescription only joint pain remained, and that China was selected the follow remedy that follows well, and it has acted marvelously. Now we are moving on to the chronic diseases. Chronic diseases are that diseases which arise from the chronic miasm and which have the following characters, which is gradual, insidious, and it is lifelong suffering. It has no tendency to decline or recovery, and it passes on through generations to generation unless treated homeopathically. So this is the speciality of the chronic diseases, or it ends in the individual, or individual will end in it. So this is the classification of disease given in Organon. A chronic disease, disease with fully developed symptoms, and disease with few symptoms. Disease with this non-miasmatic chronic disease, fully developed syndrome, miasmatic chronic disease. The general causes for the non-miasmatic chronic diseases are the maintaining causes. In acute diseases, we should that the three causes of the disease: exciting, maintaining, and fundamental. So in this non-miasmatic chronic disease, there are the maintaining causes. In the miasmatic chronic disease, they are the fundamental causes of the disease. And here in the disease with few symptoms, the one-sided disease and local disease. One-sided disease, that is show that on the mental plane or physical plane. And the local disease, that is surgical, non-surgical. We will discuss it further. Just for the reference. Non-miasmatic chronic disease. Tourism number 74 to 76. Dr. Honeyman has discussed about the artificial chronic diseases, and this disease happens due to the prolonged intake of non-dissimilar medicines. Even the homeopathic medicine, if it is given in the dissimilar way, the patient can develop the artificial chronic disease. The prolonged intake of the medicines in the large and increasing doses. And it is the biggest challenge for us also when we are practicing. If the patient is taking the medicine for a long time, it is difficult to stop that medicine. Even the restoration of the previous healthy condition also become difficult, because the vital force is much weakened due to the prolonged use of the medicine. And that case are the biggest challenge for us. Here I will be discussing a case of artificial chronic disease. Miss DP, aged 40 years, on 2/5/24 presented with the nodular swelling, pricking sensation, and itching in the eyes, which was relieved by the steroid drops. But since 3 months, this drops also have stopped responding. and patient is having recurrently this episcleritis since 5 years. On considering this totality, I prescribed Moxol because there was severe inflammation. And but when I prescribed Moxol, considering the totality, acute state of the chronic disease, but still it doesn't give the relief. And then I opted for the orthopathic approach and prescribed prednisolone. The patient improved drastically. The nodule inflammation was resolved. And what the patient said that since 3 months, I am suffering so much. My eyes felt clear after a long time. I'll show the picture. See, this was the when patient came for the first time, and this is after the this prednisolone. So then the tautopathic in the artificial chronic disease, tautopathic administration of the drugs gives marvelous results. Then talking about the pseudochronic disease. So these are the inappropriately named chronic disease because these are brought by the person on themselves because of them only. And due to continuous exposure to the avoidable noxious influences, which is also known as the maintaining causes. Occupational, nutritional disorders come under this. We can take the examples that a person living in the damp cellars, overexertion of the body, constant state of worry, etc. This leads to the pseudochronic disease. Modern relevance. Addressing lifestyle diseases, diabetes, hypertension, stress disorder, they are all the part of this non-miasmatic pseudochronic disease. Then these drug-resistant cases. Offering alternatives when conventional medicine faces limitation. Then blending with the modern challenges, integrating with diet, lifestyle, psychological care. Example, Organon approach in treating the PCOS cases, holistic individualized care. So this non-miasmatic chronic diseases, they are just addressing the recent lifestyle stress and disorders, hormonal issues, endocrinal issues. That is because of the prolonged stress and everything. Then the main comes, that is the true chronic diseases. Aphorism number 78 to 81. And this diseases arise from the fundamental cause. And fundamental cause of the diseases are the miasms, psora, psychosis, and syphilis. And when this chronic disease is left unchecked, then it continues till the end of the life. The most robust constitution, with Dr. Honeyman says the most robust constitution, base regulated mode of living, mental and corporeal regimen, and vigorous vital force are insufficient for their eradication. So they are the obstacles for the cure. They require the dynamic aid for their eradication. In non-miasmatic chronic disease, change in lifestyle and superficial acting drugs also gives the result. But in this are the chronic diseases which requires the dynamic aid. Now, Dr. Honeyman talks about psychosis in aphorism number 79. Psychosis or venereal figwort. Psychosis comes under the category of the venereal miasm. Its primary manifestation is the condylomata cauliflower-like growth, especially on the genitals, which is followed by the impure coition. And when they are removed by this ligatures or laser or like that, the disease goes inwards. There is a suppression of the disease, which is followed by the secondary elements, and they are worse than the primary symptoms. Because vital force is self-preserving, so it will throw the symptoms on the less important organ. So that's why first the primary symptoms of every miasm, that is on the skill level, because self-preservation. Medicine required thujain alteration with the nitric acid for the warts. We know that, whenever the person gets warts, na, themselves know कि मैडम थूजा ले सकते हैं, थूजा से ठीक हो जाएगा. Or the patient comes by self drugging. I'm having warts, I took thuja, but it didn't got better, than we came to you. A case of psychotic miasm. So though it was like, hello. This case we were discussing, it was like, picture perfect case I got of the psychotic miasm. A 9-year-old boy visited my clinic with many warts on the finger. Even his teeth were decayed, and he has stone-like concretions in the ears. Three doses of thuja at infrequent intervals. His hands were cleared. I didn't do, because it was an old case. I didn't took the picture unless I have it has been shared here. But that got cleared. So that was a dominant psychotic miasm case. Syphilis, aphorism number 79. Syphilis is also venereal chronic miasm, and this is developed following an impure question. Medicine is required generally mercurius. Its primary manifestations are chancres from between 7 to 14 days. If it is destroyed, then the disease will go inwards and there will be the inguinal lymphadenopathy that we say bubo. And if then also it is not there, then it leads to the ulceration and the bone caries. So disease travels inwards. In the case of syphilis, which I saw, that was a 5-year-old female having alopecia areata, multiple patches in the head, so severe that it wasn't relieved by any treatment. She was prescribed acid fluor 30 OD because it is a good antisyphilitic medicine. And it was followed by syphilinum 1M as an intercurrent. And after 3 months, the changes were, I'll show you. See, this were the changes. This is the before, and this one is the after. Now comes the mother of all the diseases. Hydra-headed monster, Dr. Honeyman has told it. Sora. This is the non-venereal miasm, each mite. The Sora is the most important chronic miasm, and our stalwarts are told that, and Dr. Honeyman has said, without Sora, no other miasm have been existed upon the human race. And the primary symptoms of Sora are the itchy vesicular fluid containing eruptions, which is followed by burning. This infecting agent is the most ancient. So from ancient, the evolution of the Sora, different kind of malignant erysipelas, plague, and this is how the Sora has involved leprosy, and then finally this itchy vesicular eruptions. The transformation of sora in the chronic disease depends on the climate, improper physical and mental training in the youth, faulty diet, habits, and customs of the various kind. Dr. Honeyman, names of the disease should not influence the physician in treatment, but names of the disease are required for the reference of the patient. So, diagnosis is equally important because with the help of the diagnosis of the disease, we differentiate common and uncommon, and then for the mental satisfaction of the patient. And if we want to make a like this summation that which kind of the diseases we are treating more frequently or which kind of patient are coming to us, then this is the thing where the diagnosis helps a lot for the prevention. Case of Sura, a 39-year-old male patient presented with a complaint of vitiligo on different part of body since 2 years, which started as a single spot on the chest, but it spread it to all other organs. And this started after the death of his brother in an accident. The patient also has the complaint of the piles since 5 years, which are non-bleeding, and it has when he has the constipation, craving for the sour food, aversion to the sweets, then unsatisfactory stool. Patient's father died of the myocardial infarction. The patient has the hobby of the roaming with friends and watching television. He has anxiety about getting married because the age is 30. He thinks that his age has gone much. And he thinks, he's in the inferiority that he looks like this, so nobody will marry him. And then the patient describes himself about he's introvert, he takes time to mix, but still he need the company. He was happiest when he got the job as a lecturer in government college. The worst moment of his life when he's lost his mother. So he's still living under the trauma. Because he used to share a good bond with his brother, and after that the complaint started. The patient is more attached to his mother and late brother and can share all his feelings. But now the anxiety about his appearance, image consciousness comes. And the considering the symptoms, arsenic, alp, phosphorus, natrium, or sulfur, they all were coming. But leukoderma is the destruction of the melanocytes. So destruction. So I first thought of the phosphorus because phosphorus is comes in this destruction remedies. But when the elements from were considered, the sulfur was the high scorer. With elements with these elements which were covered by a sulfur, and even vitiligo was covered in the 4 mark. And if we consider the psychosomatic approach of the sora is much sensitive, oversensitive to everything, and he also doesn't took the death of the brother normal, overconscious, image conscious, and this comes all comes under the sora. And that sulfur was given, and because all elements is fears everything. This was the whole lesion, and then after that this much lesion was remaining. The complex miasmatic diseases are to predominance of two or more miasms, and it have the characteristic of two, three, and all the three or four miasms. And when there is a sorana, we have to close the treatment with the help of anti-soric medicines. Whatever the combinations, but when the dominant miasm is treated, but the closure of the treatment whenever sora is present, the closure of the treatment with the anti-soric medicines. Because fundamental miasm and dominant miasm we have after the in the while processing out the case, when we take the case, when the patient gives information, the case taking portion is over, but the case in the case processing we need to find out the dominant miasm and fundamental miasm, and we have to treat the miasms accordingly. One-sided diseases or partial diseases. It is given in aphorism 172 to 230. So this the diseases which have too few symptoms and they display one or two principal symptoms, and they are not that prominent which we have, which help us to select the medicine. So that's why it becomes difficult for us to form the proper totality and to select the simillimum. This one-sided diseases, they are chronic diseases and they are generally psoric in origin. It is given in aphorism number one. Even after close inquiry, the patient reveal only one or two symptoms. The medicines should be selected on these few symptoms which are most suited to the case. Example, headache of the many years of duration, diarrhea of long standing, or ancient cardialgia. So first we will talk about the local or external diseases. It is given in aphorism 185 to 203. So these are the second time of one-sided disease. The old school consider this the skin disease only and rest of the body has no role to play. And this leads to the most disaster practice because by this the disease travels inwards. On those diseases which can be called local disease which have produced before the short time the vital force, or suppose we get a scratch or an insect bite or an injury, then this is the external, purely external lesion, and that need to be treated immediately because vital force was previously healthy. But in the other diseases like fissures, warts, eczema, here vital force is equally involved. So whenever we treat this local external disease, just by removing the external manifestation, that leads to the hazards because internal has remained as it is, just we have removed the external manifestations, and that leads to the opposite of the Herring's law of cure. Disease travels inwards. The treatment of such disease is related to surgery, but in this cases the dynamic medicines are required. In aphorism number 196, it appears Dr. Hanuman talked about the local application, that internal medicine and external local application of the same medicine. This will has quick the decrease the duration of the process of the cure, but it is not advisable. Why it is not advisable? Because the local symptom will go, but internal the derangement has gone or not, we will not know. Example, we can take off this warts. We have given thuja internally. Externally has also thuja, this mother tincture is applied continuously. So because of this alcohol and all, then the properties of the thuja, the wart will fall off. But what is remain inside? Whether it will be whether the tendency has got better or not, we don't know. So internal status we are just undiscoverable if the external state goes, and symptoms are the language of the vital force, language of the disease asked by the vital force for help, and there we are just removing the symptom. So vital force is still in the pain, or vital force has been freed from the pain, we don't know. So in the disease where the local symptoms on the external surface of the body, the application of the remedy to the surface may annihilate the local symptoms before the internal disease. This may seem the cure, but actually it is not cure. So in the one aphorism 189, Dr. Honeyman says that no external disease can exist, maintain, or grow without the participation of the whole body. The internal of the body is equally involved. So if the external symptoms are removed by the topical application, even before the homeopathic remedy for the malady has been discovered, then the main symptom upon the selection of the medicine would have rested is destroyed. And in this case, the treatment of this diseases become more and more difficult. Even as we have seen, the patient for the warts, commonly the dermatologist refers to us, they have tired. Okay, again and again we have done lasers, but it keep on coming. Now laser is also harmful for the patient because that tendency is so. Why? Because the external is removed. Now the mental diseases, the more difficult to cure owing its one-sidedness. Generally, four kind of mental diseases. This is where our art works, the art of eliciting the symptoms from the patient. Because generally, when we ask, now the patient is not going to say everything, but we have to elicit the symptoms. The four types. First is the diseases, somatopsychic mental diseases of physical origin. Somatopsychic, the mental disease from acute exacerbation of the chronic disease. Third one is the mental disease of the doubtful origin, whether they are the mental disease or not. It's not sure. And the last one is the mental disease of emotional origin. That means psychosomatic. Homeopathic mode of treatment is the only the most effective for the treatment of mental disease. It is given in aphorism number 230. So the mental and emotional symptoms in the mental one-sided disease constitute the principal symptoms. And of the totality of the symptoms, we trace the picture of the disease. The mental or symptom, emotional symptom is the first morbid symptom. And when the antisoric remedy, if it is given, it brings improvement which is long lasting, along with the psychotherapy. So homeopathic remedy is always superior in the treatment of the mental diseases, which are long standing, arising from the corporeal disease or arise with them. Then this rare drugs unknown given to such patients. Or we can say that whenever this exact the cause of the disease, we can if we consider the cause of the disease, no, the treatment becomes much easy. Psychosomatic, somatopsychic. So, Dr. Honeyman has told that when there is a threat to the mind, then the disease is transferred from the from mind to the body. When there is a threat, there is a suppuration of the lungs, the person gets the insanity because this lung is the more vital organ and vital force is preserving. Then the person is suffering from the chronic mental condition, but whenever an exciting state comes now, that mental symptoms get triggered. And the fourth one is the doubtful origin, whether it is a psychosomatic disease or whether it is a somatopsychic disease. We don't know. The Dr. Honeyman has told if the patient is better by friendly advices, then it is a psychosomatic disease. Or if the patient is not better by this advices, or it is somatopsychic. A case. A 36-year-old businessman presented on 15/11/2020 with the complaint of fatigue and dull aching pain in back, limbs, especially after coming home from work, and which aggravates from the moment. He likes to rest sometime. And even, while sitting also he falls asleep. Because, and when he wakes up in the morning, he feels his limbs are stiff. His movements are not at the ease And sometimes he get the tingling and numbness in the limb. And this was the case of fibromyalgia, the diagnosed case of fibromyalgia. This complaint started after he suffered from the breakage of partnership is informed all of sudden. Associated complaints were gradual loss of hair, especially from the vertex, since 4 to 5 years. Now his baldness is visible. Thirst is decreased, craving for the icy cold water, spicy things, eggs, and the patient is having aversion to sweet. Patient is chilly with the scanty perspiration. In the past, the patient has the chicken pox. His mother is suffering from hypertension. Height 5'11", weight 75. Its all parameters were in the normal range. His MRI of the back and everything. On palpitation, there was a hardness, a spasm of the muscles in the lower leg, and that portion was tender to touch. When I took the mental history, I found that he's restless, he's ambitious, he's more. Just a minute. He's more attached to his father because he thinks that his mother gives more attention to his sister instead of spending time with him. So his mother is not giving attention to him. She rather than gives attention to his sister. Since childhood, he has felt like that. He was sent to his nanny's house when he was young, so he didn't got the parental love as other kids of his age were getting. Can't remain alone. He need company nearby. He felt shattered when his uh, partner asked about the breakage of the partnership. He went into depression. He had many affairs before marriage. He left all. He feels his wife avoids him or not listens to him. He was happiest when his daughter was born and patient always want company. He wants to improve his lethargy, his fatigue. So the totality was considered. This the restlessness, ambitiousness, illness, mental trauma, loss of business, desire for company, depression, feeling of forsaken by the family and friends, anxiety about business, chilly patient, alopecia, baldness, fatigue, backache, and pain and stiffness all over the body. Natramur 1 1 dose was given and daily half an hour stretching exercises or advice. The patient was better. Mentally he was better. He was getting new business idea, but not difference much difference in the physical symptoms: lethargy, fatigue, backache. Then lycopodium 10 1 dose was given, and within the next visit he was for better, 50% better in lethargy, this fatigue and everything. After this 2 months, again this lycopodium 10M was repeated, and within this 6 months his pain and stiffness were gone. He occasionally gets it, but he was more energetic, the stiffness was gone, and he got new small hairs in the vertex. So my case of lycopodium was successfully treated by lycopodium, but the initial prescription was based on causation to remove the mental block of the patient. So it clears a platform or space for the constitutional drug to act more perfectly. His susceptibility and sensitivity was high, was easily vulnerable. So I opted for the higher potency in this case. 150 aphorism that talks about the indisposition. Indisposition is the what we say is a transient sickness. It's due to the exciting cause. The temporarily the vital force gets affected, but later on vital force corrects the disease by itself. If improper diet, lack of exercise, such are the causes for the indisposition. Mm. Indisposition, so not disturbed state of the vital force. It's temporary due to the exciting cause, and Dr. Neiman says a little change in diet and regimen leads to the cure of the indisposition. And if this indisposition continues for the long time, it becomes the pseudo this pseudochronic disease, intermittent diseases. So this is the beauty of this disease. They occur at certain intervals. So where a morbid state of unvarying character returns at a fixed period, whilst the patient is apparently in good state during the intervals. So therefore, the Dr. Hanima says the best time to prescribe the medicine in between the paroxysms. So they takes a departure to an equally fixed period. And alternating diseases 232. This diseases the morbid state alternate at uncertain intervals with the morbid state of different kinds. Intermittent, same kind of symptom, they have the disease free period and comes, but yet two different alternating diseases, two different state of the diseases which alternate with each other. Case: a 32-year-old female patient presented with a complaint of severe laryngitis, coughing, severe, especially in the month of February since 5 years, which is aggravated by eating, using of the voice, lying down, better by lying with the head up. At the time, also this time she also came in February. The medicine was given arsenic alb 200 with frequent repetition of the few doses. And when she got better, the treatment of the one dose of sulfur. And after that, since 3 years, she has no such attacks. In the arsenic alb introduction, there is written periodicity of the complaints. And this diseases generally they are psoric in nature. So the closure of the treatment by the anti-psoric medicine. Tourism 83 to 104, that is the most important part. Because of this only we get the everything what we want, totality, dose, potency, repetition, everything. That's a case taking. The individualized examination of a case of the patient, which are the qualities required of the physician for proper case taking. That is freedom from prejudice, attention in observation, sound senses, and fidelity in tracing the picture of the disease. And another one is the circumspection. And the another what we say that I tell my students that read between the lines. As a physician, we have to read between the lines. What the patient says always is not true, and no one will just say that I have this negative qualities all the times or much of the, but we have to read between the line. We have to discover why the patient is telling like this. So we require alertness, circumspections, sound senses, attention. The qualities we discussed, that is freedom from prejudice, sound senses, attention in observing, fidelity in tracing the picture of the disease. So in case taking of the chronic disease, so symptoms of the patient of the current treatment do not furnish pure picture of the disease. Medicines modify the disease. So in the chronic disease, pure symptoms before the starting of the treatment, another treatment also the patient was taking, is equally important. And we have to ask the patient to stop the medicine for few days, and then we can give the patient placebo. At that time we get the true picture of the disease. But we have to be careful in the cases of the chronic non-communicable diseases like diabetes, thyroid, or any autoimmune disease continuously since long 5 years, 10 years, 15 years. The patient is taking the medicine, we cannot stop that medicine. So we have to take that into totality. But if we say that the patient is taking these antacids, painkillers continuously or frequently, then we have to stop that medicines for a few days. And then we can get the pure symptoms. In rural, I will discuss a case. When we were in the rural OPD, what happened, that when we went the rural OPD, a patient came. A patient came and he told that he was having psoriasis all over the body, and that was the season. Continuously he was having psoriasis for 3 to 4 months. In that time, we weren't we took the case, we found the medicine, but at the in the rural OPD, so that medicine we were not having with us. So in that time, that case, what was there? We just prescribed SL. And when patient come for the next time, na, his condition was 50 to 60% better. So that time we realized that, get that the beauty of the case taking, a well taken case is half cured. So whatever is there inside the mind of the patient, na, if the patient gets an outlet, the patient himself gets a much better. Then medicine plays a role in acute diseases. Acute diseases are fast processing. So Dr. Haniman says there should be no delay in the treatment. And this the totality of the symptoms, there's acute totality. The symptoms of the original disease and medicinal disease form together, because the medicinal disease is more dangerous than the natural disease. In the acute cases, what happens? Intensity of the disease is much and much severe. And if he has taken any other medicine, the symptoms of medicine also joins. But we don't have that time to what we have that we have the we have at that time we don't have the time, so we need to repeat the medicine frequently, and we don't have time to wait. So acute totality, acute medicine in the case of acute diseases, because short duration, intense symptoms, so that requires immediate treatment. Another the verse that is given in the aphorism of the case taking, hypochondriac. So it is a pure fabrication of the symptom. Give placebo, if the complaint disappear, they are the false symptoms. Hypersensitive, they in the case of hypersensitive patient, deduct the exaggerated symptoms from the real one. Look for the factor to which the patient is hypersensitive. Physicians should differentiate insane patients, the patient who are suffering from the mental disease. So this patient, what they do, they exaggerate the symptoms. Or feigners of the disease, who mimic the disease, pretend to sick even where they are not. They malinger the disease. They have the malicious intention. So this we have to. I told na initially that we have to read between the lines. Genus epidemicus, case taking of in the case. So carefully invest, we have to carefully investigate the epidemic. We have to make the totality of the epidemic disease, common symptoms, and then we have to found the medicine, and that is the genus epidemicus, because for us totality of the symptom is important to form the remedy. But this genus epidemicus is a preventive and curative, which saves the time for the epidemic disease especially. So these are the aphorisms in aphorisms of the drug proving. So drug proving is necessary to know the second point for the process of the cure. So in this, Dr. Hanimas advised that how to prove the drugs. He talked about the idiosyncrasy. Idiosyncrasy is the tendency to react along with own constitution. It is not curable, but it is an plus point, because the patient is sensitive to few things. So they are the one of the best provers. Then what care should be taken while proving for the narcotic substances? then poisons. And he has told that physician is the best prover. And second best prover, what do we say that is the homeopathic students. They are the second best provers because they also dedicated towards their field. They have a good knowledge of symptoms. They can tell their feelings and sensations nicely. And with the help of drug proving how the true materia medica pura can be constructed. Now, aphorism 157 to 161 talks about the homeopathic aggravation. The homeopathic aggravation is the intensification of the symptoms which are after the administration of the medicine. So when the why the aggravation is produced? Because dose is large. And generally, the homeopathic aggravation are of three types. One is the killer's aggravation, when in the incurable cases, when the medicine is given in the higher potencies, then the vital force is not able to cope up and vital force declines. Another is the simple aggravation. Aggravation followed by the cure of the patient. And third is the prolonged aggravation. There is a prolonged aggravation, then final stage of improvement. In these cases, when the disease was on the verge of curability, it takes time and then it decreases. Repetition. The rules for the repetition are given in 246 aphorism. So as long as amelioration is progressing, medicine acting good, the repetition should not be done. So what are the indications? When when the medicine stops acting, we need to repeat the medicine. Ma'am, can I continue now? Hello? Hello? Mm. Ma'am, shall I continue? Hello? Fine, I'll continue. Doctor, to prevent undesirable aggravations of vital energy, Dr. Honeyman experimented for the last 4 years, and he, in the sixth edition, he solved this problem by new, altered but perfect method, and that was LM potency for the rapid cure, new method of dynamization. Aphorism 270 talks about the LM potency preparation. So this method forcibly influences the suffering parts of the sick man. The similar morbid affection removes the natural morbid process which influences the principle. So by growing this mechanical process, change is affected on the material and unmedicinal crude drugs. Power is not felt by the senses. That's why we tell na, the vital force is spirit like. We know its presence, but we cannot touch it, or we cannot see it. Similarly, our medicine is also dynamic. So its power we cannot uh, see it, but still, when we take the medicine, it produces the changes in the body. So the footnote of the aphorism 270, that is the preparation of the LM potency from 3C potency. 273 274 talks about the administering the single remedy. So we cannot prescribe more than one remedy at a time. single simple medicine at a time. Because why? Because substances which are naturally found combined together in a fixed form. Example, sulfur and alkaline salts, natrum sulf, calcarea sulf. So this is a different compound. So we don't need to mix two medicines together. 275 to 283. So the small dose of similimum is given. If the dose is too large, first stage produces aggravation in the chronic disease, and too large dose is harmful. It may damage the vital force. So the size of the dose should be small. But what is the small dose? So the small dose is the list of the dose which produces the change in the vital force. 284 to 285 different ways of administration of the medicine. So besides tongue, mouth, stomach, another is the olfaction, inhalation through mouth or nose. Then skin elements given the medicinal solutions with internal medicine, like any injury is there or something is there, so we can uh, take the external application. Then when nursing mother has milk has power which provides nutrition to the infant, so in every disease in child can be treated by moderate dose of similimum to the nursing mother. So the if the dose is required to give to the child, then we can give to the nursing mother. Or another thing, we can mix the medicine with the milk of the mother, and then we can give the patient. Antisuric treatment can also be given through mother's milk, and mothers given during pregnancy antisuric treatment sulfur. Aphorism 286 to 291, that is therapeutic agents other than drugs, we all know, and that we also advise to the patient. Now, with this, I end my lecture. The practical tips for students and practitioners. So keep the habit of reading Organon daily for 10 to 15 minutes for the continuous learning. Then start making case notes. So keep structured and detailed patient records. So whenever we take the case, now add a paper, then it is your workout on the case, which totality you are forming, which rubrics you are forming, and how you are selecting the remedy. Using organon in tough cases. So referring back for the guidance whenever we are uncertain, with reference to posology, with reference to this repetition and everything. Then read 5 aphorisms daily before the first patient. This will help to build confidence and clarity, and that will help for us to the diagnosis of a person. And with this, I end my lecture. Thank you. Now we are moving on to the questions. Any questions? Any questions? Just you can write down in the chat. There's a question from Dr. Pranjal, that which rubrics you took in the case of Sora. So in the case of Sora, that was the case where he was having fear. He was having this consciousness over this. He was image conscious. He was sensitive. He was suffering because of the loss of his brother. So that was a mental trauma. So this where rubrics were taken in detail. If possible, in the next lecture, I will share the slide of this repertorization. No, he wasn't lovesick, but he was having desire for company. He was more attached to mother and brother, and now he is a bit alone. And is just want to fit in the norms of society, and he needs company. That's why he get on to marry. Both were there. Hello, ma'am. Lavanya ma'am is there?
Yes, ma'am. I am here, ma'am.
Yes, ma'am.
Yes, ma'am.
Thank you so much, ma'am. It was actually a wonderful session, and we would like to looking forward for the furthermore, ma'am, for many more sessions regarding the because as due to the time session, we may have the congestion of the time. Yes, ma'am.
Yes, ma'am.
Thank you,
Oh,
ma'am. And there, I think there is a question from the
yes, ma'am.
participant, ma'am. Actually, the question is, which are the rubrics you took in the case of Sora? Like that, they meant to ask, ma'am.
Ma'am, we
Ma'am,
that
we
we already
already
discussed.
just.
Okay, ma'am. Just now they have posted, ma'am. Ma'am, was he love sick? Like that,
Ma'am,
they have
he
asked.
explained that he just wants a
Wants
company,
a
and he
company
was
and he
in
was
in the
in
norms
the
of the
norms of the.
Oh,
yes,
okay, okay, ma'am.
yes, ma'am.
Yes, ma'am.
So, any other questions from the participants? They can comment in the comment box. Actually,
Hello. So, ma'am, I don't think so. They have any questions. Hello, ma'am.
yes, ma'am. I think there are perfect with the topic. I think so. Thank you, ma'am. Thank you so much for the wonderful session. Looking forward for many more.
Pleasure,
And
ma'am.
thank you
Thank
all
you.
the participants. And we'll be looking forward for many more sessions from you, ma'am.
Sure,
And
ma'am.
we'll be right back with further more sessions, participants. So thank you all. Thank you so much. Thank you,
Bye.
ma'am.
Bye.
Yeah.